Restrooms are around the corner to your left. You basically loop all the way around if you need to use the facilities. Cell phones off, please. There'll be some time for Q&A at the end. We're going to reserve about 15 minutes, if that works for Dr. Parikh. And she is seeing patients today, so we need to stay to time. So 3:30, she does kind of have to run out of here, okay? I know a lot of you like to ask personal questions, which is great, but just know if you don't get to it, you'll have her contact information. I'm sure you can always ask her at a later time, all right? So let's get into it. I have a nice introduction for her, and then I'll let her take the floor. So,
yeah, I'll have some cards.
She has cards, and you can get it from her at the end. She'll leave me some too, okay? So a little bit about Dr. Parikh. While growing up in India, she developed an interest in ancient traditions of yoga, meditation, and started practicing at a very young age. She moved to the United States as a teenager and is a graduate of the New Jersey Institute of Technology. After college, she embarked on a solo spiritual journey through Southeast Asia, where she advanced her interest in Eastern medicine. She went on to graduate from the Robert Wood Johnson Medical School and completed her internal medicine residency here at New York Presbyterian and Walk Cornell Medical Center. Dr. Parikh is now an assistant professor in the college, where she plays an active role in medical education, research, and patient care. As a board-certified internist and diplomat of the American Board of Integrative and Holistic Medicine, she has co-founded Integrative Health here at NYP and Walk Cornell. This program provides integrative modalities such as acupuncture, meditation, yoga, nutrition, psychotherapy, guided imagery, Reiki, and functional medicine to patients and staff. So please join me in welcoming Dr. Parikh. We're very excited to have her.
Good afternoon. Thank you so much for having me and showing up on a rainy afternoon. I forgot my free sample, so if that's what you're looking for, tough luck. But hopefully we'll have some good conversations going today. So I just want to start out, we'll get right into the medical marijuana piece, and I want to spend a little bit of time talking about the program as well. So first of all, medical marijuana, there's a lot of myths around it. There's a lot of misinformation and confusion. So I hope I can clarify some things for you and give you sort of the more up-to-date knowledge of what's relevant clinically at this point. So when we talk about marijuana, there's a lot of terms, all these terms you might have heard of: cannabis, hemp, marijuana, CBD, THC. So I just want to put that into perspective a little bit. So cannabis is the plant family that the hemp plant and the marijuana plant belong to. So cannabis is the umbrella sort of species, the plant species that the hemp and marijuana are part of. So sometimes people think about hemp plant as sort of the male plant, I believe, and marijuana as a female plant, but they are quite distinct. So the reason why they're distinct is their chemical structure, the compounds that they make are quite different. So in the hemp plant, makes mostly a compound called CBD that does not make you high. The CBD molecule is not very psychoactive. So the hemp plant is legal. You can grow it, you can consume the CBD that comes from hemp. So a lot of times now you'll see CBD supplements sold in health food stores, or you might be offered to add a few drops of CBD in your coffee at your coffee shop. So that CBD we're talking about is coming from the hemp plant. And hemp plant is grown very widely. It's because it's used for a lot of industrial things. So the fiber from the hemp plant actually makes things like ropes, fibers. Actually, my winter coat is made out of hemp. So there's a lot of industrial use for hemp. The marijuana plant, as you know, is often used recreationally or medicinally. The reason being the marijuana plant contains a CBD molecule, but also the THC molecule that has more psychoactive properties. So the THC part is the one that gets people high. So I just want to clarify, when we're talking about CBD, we're talking about THC, when you hear terms cannabis or marijuana or hemp, I just want you to understand how distinct they are. So talking a little bit more about the molecules that these plants produce, so one of the molecules is the CBD that we talked about. And it does have a lot of medical benefits. It tends to have more of an anti-inflammatory property. So we'll often use CBD for more inflammatory conditions because it's also not psychoactive. It can be generally used, and it's relatively safe to use, and often doesn't interact with many other medications. There are many cannabinoid molecules in each species. Just like any plant could have different species and different flavors of compounds it produces, the CBD molecule can come in different flavors essentially. And the research behind is still not caught up, where we don't know what each of these molecules really do. All we know is that this group of molecules tend to have a more anti-inflammatory effect. And now talking about THC, that is a more psychoactive component we talked about. And that binds to something called cannabinoid receptors in the brain and leads to that getting high feeling. So the cannabinoid receptors are activated by the THC molecule that comes from the marijuana plant. Terpenes are another class of molecules that you will often find in these plants. And terpenes are really responsible for the smell of the marijuana and also the color of the plant sometimes. And terpenes also, we don't really know what the therapeutic benefit of the terpenes are, but what we do know through research is there's something called I forget the word for it, but there is an effect where all these molecules act together synergistically. It's called the entourage effect. In the way that if you just give CBD, it doesn't work completely. It needs a little bit of THC for the CBD to get activated. If you just do THC, it doesn't work completely unless you have a little bit of CBD. So it's called the entourage effect. So that's something we do know. And that's probably the reason why in ancient cultures and other medicinal traditions, the plants are often used as whole. In Western medicine, we tend to separate different compounds for therapeutic benefits. But in more traditional medicines, the herbs are used as whole because there tend to be this synergistic effect that we don't really completely understand what each molecule does. But there's a reason why Mother Nature probably made it together, because they all work synergistically. So that is something we are aware of. And we do, when we prescribe medical marijuana, we do keep that in mind when we prescribe it. And just to be clear, the marijuana remains classified as Schedule I drug under the federal government, and it is considered, it's not recognized for medicinal use on a federal level, but each state has its own regulations as to whether it's allowed in the state for recreational use or medicinal use. And it's regulated very tightly at the state level. So terpenes, again, there's many different types of terpenes that gives the plant different flavor, different aroma, and they all tend to have a different therapeutic effect. What we've studied in rat models or in vitro studies, but we don't really know much about the effect it has in the human body just yet. So a lot of the use of medical marijuana, or just marijuana in general, the use and the commercial aspect of it is sort of going way faster than the specific research component of it. I think there's still a lot more we have to learn what this plant can actually offer us. So as of November 2018, about 32 states in the country have approved medical marijuana use. So again, just for clinical purposes. The states that are highlighted in dark green have also approved it for recreational use. And as you know, Canada also recently approved it for recreational use. So again, the tide is sort of returning in the way, and this trend is taken up across the country, and more states are approving definitely for medicinal use, but also for recreational use. And that's why it's very important for healthcare providers to be more knowledgeable about the indications of medical marijuana and also how can it be incorporated into the medical practice. And also for consumers and patients to be more aware of what the legislation and what the rules and regulation are really in the state and how it can be of benefit for them if it is clinically applicable. So just to give you an idea, in New York State, most of the medical marijuana that is prescribed tends to be for more severe conditions, and I'll go through the list of conditions it's approved for. Just to give you an idea, more than 50% of patients actually use it for chronic pain diagnosis, and about 15% of patients use it for neuropathy, and about 12% of patients use it for cancer. Even though if I was to ask most people, whether it's healthcare providers or patients, I think most people tend to think that medical marijuana is often prescribed just for cancer patients. But as you can tell, more than half of the times we actually use it for chronic pain. And chronic pain could be in any part of the body. It's usually more severe pain, usually lasts more than 3 months. That's technically the definition for chronic pain. And most of the patients, and again, that's another myth, that most of the patients that use medical marijuana are open to it tend to be more younger patients, but that's not necessarily true. Patients from age 51 to 60 made up 23% of the certifications, and patients 61 to 70 made up 19%. So more than half of the patients tend to be of age 50 and up. So again, that myth is really not true. That's only younger patients that are open and feel comfortable using medical marijuana. And as of this month, there have been about 2,100 certified practitioners, so medical providers, who are certified in the state to prescribe medical marijuana all across New York State, and almost 80,000 patients have taken advantage of this program. Just to give an idea, Governor Cuomo passed an act back in 2015 that allowed for medical marijuana program to come into effect in 2016. So really talking about just in a couple of years that this program has been quite successful, and a lot of providers have enrolled in it, and a lot of patients have taken advantage of it also. And also of note is the program allows for caregivers to enroll as well. Because a lot of patients in general are too sick to be able to go every month to have to pick up their medical marijuana supplies. So caregivers can actually be certified to be able to do that on behalf of the patients. So up to 2 caregivers can be certified per patient. So it will allow them to be able to go to the dispensary and pick up the supplies on behalf of the patient. So how does this really work? So what are the nuts and bolts of this program? So if you're a physician or if you are a medical provider, then you basically need to go through a 4-hour online course to familiarize yourself with medical marijuana. Once you do that, then the state allows you to register online as a certified provider. And once you register with the state, then the physician can actually certify other patients for medical marijuana. So that's what the medical provider has to go through. So not all doctors are able to do this. They have to be educated in it, and they have to be certified under the state to be able to do this. And if you're looking for a practitioner who can provide medical marijuana, you can go on New York State Department of Health website, and they have a whole list of providers who are certified. So you can find something in your area that you're interested in. And for patients, the way it works is a patient will come to me, will be referred to me, either they're existing patient of the program, or they're a patient here at Cornell New York Presbyterian, and their physician will refer the patient to me to see if they would benefit from medical marijuana. So once I get the referral from the other physician, or my existing patient comes to me requesting it, or if I think that it would be of benefit, as long as it meets certain criteria, which we'll go through, then what happens is I certify them in person in my office. So I basically go on New York State's website, add the patient's information so that they're in the database. And then the patient has to create their own New York State account just so the state can verify they actually live in New York State. So this program is only available to people who actually reside in New York State. So when you register as a patient with New York State, they want either a government ID or something to prove that you live in New York State. And then right then and there online, it takes about a few minutes, you're able to print out a temporary medical marijuana card. And you can take that and go to a medical marijuana dispensary and then get medical marijuana the same day essentially. So it's really encouraging to see that the state has come around and made some of these processes a lot more lenient and a lot easier. Before, patients would have to wait for an actual medical marijuana card to come to the mail, and that would sometimes take 2 to 3 weeks. And if you're in a lot of pain, that's a long time to wait. So you still get a medical marijuana card in the mail, but you don't have to wait for it. As soon as you register online, you're able to print it out, and you can go to the dispensary the same day. You do need the card if you are traveling out of state. With the medical marijuana products, you have to carry that on your person. So if you're flying or traveling, you do need that medical marijuana card with you. So these are the indications that currently the state approves the use and prescription of medical marijuana. So on the left side are all the diagnoses, so things like cancer, HIV, ALS, Parkinson's, multiple sclerosis, spinal cord injury, inflammatory bowel disease such as Crohn's, ulcerative colitis fall into that category. Neuropathy, this neuropathy could be because of chemotherapy, it could be because of diabetes, or it could be for other reasons. Also Huntington disease, PTSD, chronic pain, like I defined chronic pain of more than 3 months, and it has to be severe enough. And it's also approved for patients who are addicted to opioids. So again, one of the myths that was prevalent before was people thought that if patients are already on opioids, or if they have problems with addiction, that they should not be given medical marijuana because they will just get abused and get addicted to that too. That is not true. Now we actually use medical marijuana as a bridge to take people off of opioids and help people get off, opiate addiction as well. And almost on a regular basis, every few months I check in with this list because the state is adding more and more diagnoses. In the beginning, when the program was approved, there were only 3 or 4 diagnoses, things like cancer, HIV, I believe ALS, and Huntington disease were the only few ones that were approved. So the last year, the state has added more and more diagnoses to this list. So you not only have to meet the criteria on the left, but you also have to have severe enough condition. So let's say if you have chronic pain, but it doesn't really affect your daily function, it doesn't really cause severe enough pain that limits your mobility or day-to-day functioning, then you don't really qualify. So all of those symptoms have to be severe enough and have to have one of these things associated with it for you to qualify. So it's not just that if you have very well-controlled pain or any of these diagnoses, you technically don't qualify for medical marijuana. So again, your physician will do a thorough assessment and see if you meet the criteria. And once you do, like I said, you will meet with the practitioner, they'll certify you. Once you get the certification in person and you register online, you'll be able to get your medical marijuana card, the temporary one, and then you can go to a medical marijuana dispensary. So once you get certified, you don't go to like a CVS or Duane. There's specific medical marijuana dispensaries that are approved by New York State and are very well regulated. They do quality controls. It's very expensive for someone to open a medical marijuana dispensary because they have to follow a lot of rules and regulations. So there are several in New York State now, especially around Manhattan. There's quite a few that I send my patients to. And they're all really good. They have really good qualified pharmacists. And you actually, most of my patients end up meeting with the pharmacist at an initial consultation. And the pharmacist will go over your existing medication list to make sure there's no interactions. The pharmacist will also ask you about your symptoms so they can figure out what's the best sort of formulation and dosing for you. So this is one of the pharmacies that I send a lot of my patients to. It's called Columbia Care. I think it's around Union Square. And they've been really good. All these dispensaries have been very good. So there's 4 different ways you can take medical marijuana in New York State. So it can come as a sublingual tincture, so essentially drops you put it under your tongue, or it can come as vaporization oil. So it comes in like one of those vaping pens. It does not create smoke, it's just a liquid that goes into the pen. And there's also capsules and tablets. So the major difference between these formulations is really how long does it take for the effect to kick in and how long does it last. So the fastest one to kick in is the vaporization because you're inhaling it. So it kicks in within a few minutes, but it only lasts maybe an hour or two, not even that much in my experience. Usually within less than an hour, the effect fades off. The second one is the tincture. So it kicks in within 20 to 30 minutes, and it lasts about 3 to 4 hours. Versus the tablets and the capsules typically take 2 to 3 hours to kick in and might last 6 to 8 hours. So again, every person will process this differently, but this is sort of like the general guideline. So if you are someone who has chronic pain all the time, then you might need something like a capsule or tablet that lasts a bit longer. So you're not using the drops all the time. But if you're the kind of person where the pain is more severe when you have to walk or when you're sleeping, more specific times, then the drops might be better. Or if you're someone with severe pain, so some of my patients with metastatic cancers or things like that, the pen is always a good option because it kicks in pretty much right away. So again, the doctor can regulate which formulation he or she approves you for. So I can control and say, I'm only approving you for the capsule, or I'm only approving you for the drops. And I can also control whether I'm approving you just for the THC or just for the THC or CBD or both. So the doctor has a lot of control over how much they want to approve you for and for how long. The maximum time they can approve you for is about a year. So it could be from a month to a year. The doctor might require to come back every month and reassess, or they might approve you for 3 months. It's really up to the discussion of the doctor and the conversation you have with your physician. And not just physicians, but also NPs and physician assistants are also able to prescribe. So it might not necessarily be an MD, it could be an NP or a PA as well. So these are some of the more popular dispensaries in New York. And they all have their slightly different formulations. So if I was to prescribe someone a blood pressure medication, then let's say metoprolol, then metoprolol 25 milligrams that you get from Duane Reade is the same as metoprolol you get from CVS. But when it comes to medical marijuana, it's not as standardized just yet. Each dispensary has their own sort of marketed product in a way, so different combinations. So for instance, Columbia Care has 3 different formulations where they have something called 20-to-1 ratios. So they can make all of those 4 things that I talked about, the pen, the drops, the tablets, or the capsules, as 20-to-1 ratio of high THC or high CBD or equal amounts of CBD and THC. That's typically what most pharmacies will do. They'll have a formulation with a lot of THC, a little bit of CBD, a lot of CBD with a little bit of THC, or equal amounts of both. And that's basically where the pharmacist will start. So just so you're aware, if you're switching between pharmacies, just make sure they're aware of the other formulations, because it's comparing a little bit like apples and oranges, not a straightforward comparison. So these are so how would I certify a patient? How would I know, or how would the pharmacist know what's appropriate for you? So typically for the high THC, formulations are traditionally used to treat symptoms such as severe pain, nausea, vomiting, to stimulate appetite, to help people gain weight, and for difficulty sleeping. And the formulations that are for more high CBD tend to be used more for sort of anti-inflammatory purposes, so would use it more so for patients with neuropathic pain, neuropathies, inflammatory bowel disease or anxiety, with seizures, and for muscle spasms. And somewhere in between, if patients have overlapping symptoms, sometimes we might use an equal formulation. And if someone who's never smoked pot or never been exposed to any of these molecules, we'll start with a 1-to-1 and see how patient responds. So a lot of this is really customization, personalization. So I always encourage my patients to follow very closely with myself and also the pharmacist. Because the pharmacists are very knowledgeable. They're able to titrate the dose based on your feedback. So as a physician, I typically, sometimes I'll regulate what I approve patients for, or sometimes I'll just say up to pharmacist discretion and have the patients work closely with the pharmacist. So it really depends on the provider and what the patient's requiring. So that's the part about medical marijuana, and I quickly want to introduce you to the program here at Cornell and New York Presbyterian that I'm very proud of to be part of, and I started this along with my colleague about 3 years ago. And it's called Integrative Health. I'm sure you've heard of the terminology integrative medicine, and that term has really evolved from being called as alternative medicine to complementary medicine to now integrative. So what is the difference between these terms? So alternative basically means, let's say I diagnose someone with diabetes, but instead of taking medications, they chose to just lose weight, go see a nutritionist, and they chose not to do medications. That's an alternative to the medications. Complementary would be they are prescribed medications, they take the medicines for diabetes, but they're also seeing maybe an acupuncturist or someone to take supplements or herbs for it, or working with a personal trainer to lose weight. But the person who is prescribed the medication is not necessarily aware of what else you're doing. So these things are kind of happening, right arm's not talking to the left arm here. The integrative medicine approach is really kind of combining the two. So if I'm a physician prescribing medication for diabetes, I'm also recommending that you see a nutritionist, that you also see someone to help you lose weight, that you also see a psychologist perhaps to help you with emotional eating, right? And all of these services, recommendations are happening under one group. So that's the model of care we truly embrace. So bringing together a lot of these evidence-based modalities under one group, not just focusing on passing out pills, but also focusing more on addressing the root cause of the disease and focusing on improving the quality of life of the patient. So integrative medicine is more about personalizing it, using evidence-based medicine. No two people with diabetes will have the exact same treatment plan, because the treatment plan is not limited to medications, right? For one person, the challenge could be losing weight. The other person, it could be emotional eating, right? But they both might present with diabetes. So their care plan would look slightly different. It's not just about physical symptoms. You also have to address psychological, spiritual, social, and environmental influence on health. This is so important. So even World Health Organization defines health as not merely as an absence of disease. It defines it as a balance between the emotional, psychological, and physical well-being. That's the definition of health. And Hippocrates once said it's far more important to know what kind of person has a disease than what kind of disease a person has, right? So that's what we're really coming back to, is understanding the person who has a disease and not just going by the labels of diagnosis and symptoms that someone comes to me for. So really focusing on prevention, how do we prevent diseases rather than just wait for people to get diseases and then end up treating it? and focusing on the root cause, because someone might come in with 5 different symptoms, but turns out the root cause is just one, right? So I get much more benefit if I address the root cause. It might take longer, but it's a much better way of approaching the patient. Focusing on quality of life. It's not just enough that we make ourselves live a little bit longer, but it's also about how well are we living, right? It's not about just surviving, it's about how to thrive during the time as well. And no one person can do this. So the team-based approach is so vital, right? So it's not just the physician, it's not just the patient, but having a support team around both of them can be really vital. And patient engagement and empowerment, you are all here because you're interested, you want to take ownership of your health, you want to educate yourself. And I think we as healthcare systems and physicians need to do a much better job at providing venues like this and educating our patients and encourage them to play a more active role in their healthcare. And again, it all comes down to the foundation, which is the diet and the lifestyle, right? So anytime we're treating any person, it comes back to changing the diet and lifestyle in a way that's sustainable. It's not about a crash diet, not about just crashing a habit for a few months. It's about creating sustainable change that will really reward you over and over again. So the reason why we're talking about integrative medicine is not just because it's not one of those bad things. It's more than 40% of Americans actually use integrative medicine. They just might not discuss it with their healthcare providers, but more than 40% of people are already using it. And the second important part is that the research behind it. So NCCIH stands for National Center for Complementary Health and Complementary Integrative Health. And it is part of NIH, the National Institute of Health. And just to give you an idea, their funding in about 1980s to 90s was about $2 million. And as of 2015, their funding has gone up to $120 million. So a lot more funds are actually going towards researching more holistic medicine. So a lot of the research that's come out in the 10 years is thanks to this funding. And now we know that a lot of these modalities have been around for hundreds, if not thousands of years, actually work. So NCCIH funds a lot of studies that have come out in recent years on things like acupuncture, meditation, yoga, tai chi, a lot of herbal medications, supplements, and things like that. So it's really encouraging to see that this whole movement towards integrative medicine is not just because patients are looking for it, but there's also research and evidence to back up that these modalities do work and they're safer. So most common reasons why patients come to integrative medicine centers is really chronic pain, GI disorders such as IBS or acid reflux or inflammatory bowel disease, mental health such as anxiety, depression, PTSD, patients with cancer diagnosis, and stress. And there's obviously overlap. One person can have more than one of these things, and they tend to often coexist, right? So if you have underlying anxiety and depression, that might make some of the other symptoms worse, especially things like pain. They're so interrelated. So it's important, again, to come back and look at the whole person and address the root cause. So we were right across the street, actually that way, on 69th Street. We started the program about 2 years ago, and currently we offer services such as nutrition, acupuncture, psychology, yoga, meditation, massage therapy, Pilates, and a lot of stress reduction techniques as well, and coaching. So people always ask me what sets us apart from a primary care doctor. We don't do primary care doctor, we do primary care sort of practice, but we really focus on the integrative medicine piece. So we do consultations for patients. And I typically spend about an hour with each of my new patients. So besides just asking about your typical medical history and things like that, I spend a lot of my time focusing on diet, focusing on sleep, gut health, focusing on stress levels, activity levels, all of those things that are so foundational to creating health and well-being. And like I said, no two people are going to walk out with the exact same personalized plan because two people are different. And the team-based approach, so a lot of this treatment will include other team providers, such as seeing a nutritionist or an acupuncturist, or maybe participating in a meditation class. So it could be one or all of these. And continuity of care is so important when we're trying to make behavioral change, right? None of these things can be fixed by a magic wand. I wish I had one. But it really takes a lot of support and continuity. So often we'll do things like group sessions, we'll do things like telemedicine, to make it easier for patients to kind of continue to follow up with us. And again, we're always looking for the evidence. There's always new research studies coming out supporting these integrated modalities, and our job is to bring it to practice as soon as possible. So this is our team. We have 4 physicians right now. Myself, Dr. Gupta, and we're trained in internal medicine on the left, and the 2 of the other physicians are trained in family medicine. We currently see patients anywhere from age 13 and up. And we also have the rest of providers, our nutritionist, our psychologist, our massage therapist who's also a Reiki master who does our Reiki classes as well, our acupuncturist, and we have an amazing team really. All of these providers have extensive experience working with very medically complex patients, and they've been really instrumental in the success of the program and growing in such a short period of time. So we currently offer all these services. We do accept insurance for things like acupuncture, nutrition, psychotherapy, and physician consultation. And again, every plan is different, so I do encourage you to consult with your insurance provider, see how many of these services will be covered. We do offer a lot of things in a group setting as well to make it more affordable and accessible for patients. So we do have targeted yoga classes, Pilates classes. We're also adding Tai Chi and Qigong classes in the next couple of months. And we have something called shared medical appointments for stress management, for pain. We also have group acupuncture for patients who can't afford to do one-on-one acupuncture. We also do Reiki classes, meditation classes. And we also have a free program called Prepare for Surgery and Heal Faster. That's a program that's been proven. It's a 1-hour class that you can take either in person or virtually online that's been shown to reduce the amount of use of pain medications and anxiety medications and faster recovery from surgery. So we really encourage anyone about to go through surgery, about to start chemotherapy or radiation, we really encourage you to take them, to have them take this class, and it's available for free. And we also, on our website, we have a whole library of guided meditation, some gentle yoga videos that patients have access to for free. So if you want to practice at home, you can access this as well. If you just type in Integrative Health NYP, our website will come up and you'll be able to access all of these videos. And even on the NYP app, we have these videos available. So just to give you a little virtual tour, we were very lucky to have the support from the hospital, from Cornell, and from very generous donors to be able to create a space that really spoke to the philosophy of integrative medicine. We did not want it to look just like 4 white walls, so we spent a lot of time the last 2-3 years working with the architects to make sure the space itself was lively and made a contribution to the healing environment. So we used a lot of natural materials, really kind of soothing music and lighting and accents that kind of remind you of being in nature, because we all do suffer in New York City from nature deprivation for sure. So these are our typical treatment rooms and our meditation sanctuary. And we also have large group spaces for our yoga meditation classes and more seminar style classes as well. So that's our program, and I really encourage you. I did bring some flyers about our upcoming classes. We have a Reiki 1 class coming up. We have meditation classes coming up. We also have a cooking demo that teaches you how to make more plant-based recipes at the kitchen across the street coming up. So if you're interested, we have those available for you, and also have brochures for our program. So I think that's all I had to share with you, but I would love to ask for, take some time to answer some questions.